Hello, I'm Dr. Bryan Hulsey of Foundations Chiropractic in Lake Oswego, Oregon, and I wanted to talk today about thyroid hormone metabolism and some tests that are commonly ordered there and what needs to be ordered in order to adequately assess thyroid function. On the medical side of things, what is commonly checked? What is commonly checked here is TSH and free T4. So TSH, or thyroid stimulating hormone, comes from the pituitary gland and acts on the thyroid gland. Free T4 is a measure of unprotein-bound thyroid hormone. However, it's not the most metabolically active thyroid hormone that we have. Some of the tests that need to be checked, we do need to check TSH, we do need to check free T4, but we also need to check free T3. Free T3, this is our most metabolically active thyroid hormone. But in a lot of cases, this hormone isn't checked. This thyroid hormone isn't checked. Why aren't we checking that? Well, I don't know, but that's one thing that definitely needs to be checked. So with that, we also check total T4 and total T3. This is what the thyroid actually produces. So if we're not checking this, we're not getting a good measure of what is actually coming out of the thyroid gland. So 93% of what comes out of the thyroid gland is actually total T4, and about 7% is total T3. T3 uptake is a good test because it gives us an indicator of a relationship with thyroid binding globulin. Imagine this is our taxi cab through the body in which the thyroid hormone is taken. So most of your thyroid binding globulin is used to take total thyroid hormone out of the thyroid gland and take it through the body to where this protein is cleaved away, or thyroid binding globulin is cleaved away. Most of that occurs in the liver. So we need to check a full CBC and chem screen to check for liver function as well. We also need to check for free thyroxine index. This gives us an indication of how much free thyroid hormone there is. Most times, thyroid peroxidase antibodies and antithyroid globulin antibodies aren't checked because this isn't going to change medical treatment, which is most likely thyroid hormone replacement, especially if you have high TSH. So if you have high TSH, that means that you're hypothyroid. But the range is so broad that a lot of people still have thyroid symptoms, but they're not being picked up. So there's many different ways that we can have thyroid symptoms, and just looking at the tests that need to be run, you can see that a lot of it is being missed. So if the thyroid peroxidase antibodies and the antithyroid globulin antibodies come back positive, this is more likely an immune issue and not just a thyroid issue. Now, if it's an immune issue, there's some other things that we need to look at. Possibly food sensitivities, we need to look at gut infections, we need to look at vitamin D levels, we need to look at possibly leaky gut or intestinal permeability, which we'll talk about on another video here. But if TSH is very low and we're suspicious of Graves', we need to do a thyroid receptor antibody test. So all of these are immune issues. So the immune system is attacking the thyroid gland, causing it to break down. And we can have too much release of thyroid hormone, so this can give some of the hyper symptoms, such as heart palpitations, as well as the jittery weight loss in addition. So that'd be high functioning thyroid. Low functioning thyroid would include weight gain, unexplained weight gain, energy issues, fatigue, maybe overall discomfort, and like fibromyalgia could be actually a thyroid issue. And then reverse T3 works as a stop signal. So if we're not measuring free T3, which is the most metabolically active thyroid hormone, and we're not measuring the stop signal, that could definitely be a way that thyroid could be disrupted, or thyroid hormone pathways could be disrupted.